So we are here today with Jessica Eaddy, who is one of our interviewees who is actually has been diagnosed with coronavirus. And so we would really like for Jessica to share just a little bit about herself, and then I will start the interview questions. Thanks for being here, Jessica.
Thank you for having me. So my name is Jessica. I am 37 years old. To my knowledge, prior to this, I had no underlying health condition. I was relatively healthy, like eat organic, sustainable food, and exercise, not as much as most people in Colorado, but more than most of the country. And yeah, I was, to my knowledge, healthy. I got sick. Well, I started experiencing symptoms of COVID on March 16th of 2020. And today, on April 28th, I'm on day 43. I'm wearing sunglasses in this interview because I most recently was diagnosed with uveitis, and I'm on cyclopentolate, which is an eye drop that dilates your pupil and essentially paralyzes the muscles in the iris, and then steroid drops to lower the inflammation. And so I'm super light sensitive, and I wanted to just show up and do this interview the way that I feel is transparent and accurate to how COVID is going for me on week 6. I've had 2 rounds of treatment for pneumonia during the course of my 6 weeks. And yeah, so I've had like 2 rounds of antibiotics for that, and then the uveitis treatment. So that's where I'm at. I'm super blessed and grateful that I have not been hospitalized, although there was a week where I was on the phone with my primary care physician, probably 3-ish days in a row, where we were evaluating whether or not I needed to go and be hospitalized. And we were making it like a day-by-day decision. And I'm really grateful that I've been able to quarantine myself at home and take care of myself enough that I was able to stay out of the hospital.
Thanks, Jessica. And so I also wanted to just have you share where you live, and do you work in your community, or do you work both in your community and outside of your community, just so people kind of know, you know, how you may have contracted this.
Sure. So I live in Chaffee County, which is a rural mountain county in the central mountains of Colorado. And I live right outside of the town of Salida. And for my job, I work both in Chaffee County, like public health and behavioral health and medical professionals and the general public. And then I also work in the San Luis Valley, and then all the way up to Utah and all the way up to Glenwood Springs, Aspen, Carbondale area, and then back down in like Summit and Lake counties.
So that just gives the listeners an opportunity to understand that, no, you didn't travel out of the country or anything, or even out of the state, but you're on the move.
Yeah.
Yeah.
I did have to fill out a questionnaire for work when I was reporting COVID to my job, and they asked if I had traveled out of the state since January 1st, 2020, which I thought was a really interesting question to ask because I have traveled. I did a cross-country road trip from North Carolina, where I'm from, all the way out to Colorado in early January. And so I had to list, like 10 states I went through in addition to my travel within the state. But as far as within a 2-week period. Before I started experiencing symptoms, I had only been in maybe 4 counties in Colorado during that 14-day period before onset of symptoms.
So, Jessica, what has been the most difficult adjustment to your work life due to COVID, not just because of the quarantine, but your own health condition?
I pretty much quit working. So I've probably used 150 hours of sick time in the past 6 weeks. I'm probably pushing 200 at this point. And so my work life has pretty much just stopped, to be honest. I'm really, really grateful that I work for the university, and they not only gave me all the sick leave that I had saved up, because I don't use sick leave very often in my job. So I had, I think I had 197 hours saved up before I got sick, which I'm like so grateful for now. But they also granted me 80 hours of emergency COVID leave. So anyone who works for the university who has been diagnosed with COVID or is caring for a loved one with COVID can use 80 hours of paid leave that doesn't come out of their sick time. And so I used all 80 of those hours. And so my job has just been so supportive and kind and generous and sending me gifts. There's been no pushback. They've just been the best at trying to support me and support my health through this time and not pushing any responsibilities on me. So I've essentially barely worked.
So you have an employer who is helping you heal.
Yes, I do. I'm so grateful.
That is so great. So what would you tell us are your current challenges right now?
My current challenge throughout all of this, which is also current to now, is just how little we understand COVID as a medical and research community. And so I have kind of no idea what to expect for next steps every step along the way, because I'm kind of on the earlier wave of individuals in Colorado who got COVID. So March 16th was pretty close to the beginning of our testing in Colorado as a state. And so I just feel like I'm kind of on the beginning edge of this, not compared to New York City, obviously, but for out here. And so every step along the way, it's been, I see more research and more journal articles and more health information coming out about 2 weeks behind where I'm at. So for example, the CDC just added 5 new symptoms, maybe within the past week, of how to diagnose COVID and what it might be symptoms that they're including besides the fever, the cough, and the shortness of breath. I had all 5, but because it wasn't listed in the symptoms in March, I thought initially I had the flu. Then I thought I just had a virus. I thought I had strep throat. I went through all these different phases of guessing games, whereas now with information out, I think I would have been more prepared. And so to that end, I feel like I'm still kind of on the front end. Like they're just now discovering there's a link between conjunctivitis and COVID. It's not listed as like a symptom yet. But they're seeing more people who present with conjunctivitis, which is pink eye. And I was misdiagnosed with pink eye at my ER because that's the thing that's associated with COVID. I was sent home with the wrong medications for what I have, which is uveitis. And if I hadn't had the medical knowledge that I have from my line of work, I'm not sure what would have happened, to be honest. So I, came home and was like, I don't think this is conjunctivitis. I don't think my symptoms fit this. And I just kept calling doctor after doctor until I could find someone who would listen and take me seriously and say, hey, I think you have a much more serious condition. Uveitis that's left untreated can only be find. And so treated by just the lack of knowledge and the somewhat dismissive attitude of some healthcare professionals when diagnosing and not being willing to think out of the box and explore other options. So after I was diagnosed by a different physician with uveitis and given the proper treatment, I started doing my own research on PubMed, and I found that there's a link between anterior uveitis, which is the type that I have, and COVID in animal models, but they haven't yet linked it in humans. And so I'm really curious to see if in a few months from now, the ocular research community has found that not only conjunctivitis is linked to COVID, but other ocular diseases. So that's a very long way of answering your question, but I just think I have example after example of, being kind of on the front end of this whole epidemic and not having access to the knowledge just because we don't know, and it's not anyone's fault. We just haven't had time to do the clinical trials to establish stuff yet.
Thanks, Jessica. So when we talk about the influence on the future of healthcare, what would you say the impact of this will have on our healthcare system?
I think that's a great question that I don't know if anyone knows yet. I think that we will have social distancing in place more effectively. I think we'll be able to triage people who are very sick with any contagious disease more effectively, because we're all going through this learning process, sort of stumbling blocks of trying to get into, for example, trying to get into my local ER took me 25 minutes of sitting in the parking lot, trying to get someone to come out and help me get in, trying to get me triaged without having to go to the front desk. And I think that in the future, we won't, no matter what the disease is, we'll probably be better equipped to get patients in quickly, provide them care quickly, and have, stuff set up for sanitizing, making sure that waiting rooms and patient rooms are cleaner, making sure we can separate super sick and contagious people from individuals who are very ill and maybe in a vulnerable state due to like cardiac issues or something that's not as contagious. And I'm hoping that we will have a little bit more humility as a medical community in recognizing our limitations and being really open about what we do and don't know. And one positive impact I'm seeing, and this is, I guess, more from the public health perspective than healthcare providers, but more and more people are getting interested in learning about their health and learning what proper hand washing is. Or, for example, my boyfriend is a plumber. He didn't go to college. He didn't go to graduate school. He has no medical knowledge. And so for him, I think this is a really educational opportunity where he's learning. I remember when I first called him and I said, I don't feel good. I feel like I have strep. I have a fever. And he was like, a fever? That's when your temperature is high? And I was like, well, this is going to be a long road. And so I think that our healthcare community will not only learn a lot and be better at disseminating information to the public, but I think that the public will be more receptive to learning about it because they finally understand the links and how it really impacts them.
Yeah. So, Jessica, your workplace is on a university campus. So what will you tell future students about this event?
Ooh, goodness, I could talk for hours to future students from both a public health and a behavioral health aspect. My background is I'm a social worker, and I was a clinician for mental health and substance use disorders for adults. And so I can talk from that perspective about the impact on mental health and the impact on substance use and relapse, the impact on housing, the impact on the healthcare community, and then just the impact on patients. So I think I could go on for quite a while about that.
So I know this is a really tough question, but I am going to ask you this as a thought-provoking question. What are the current gaps in our current education preparedness, do you believe?
Well, I would say that we definitely have gaps in rural healthcare. And so I think that in education preparedness, we are doing a pretty good job, from what I can tell, of getting family medicine students and primary care students interested in rural healthcare. But getting access to specialists in rural areas is just such a huge barrier. And I'm not sure if that is a lack of training for current students to become specialists and then also have that rural track focus, or if that, I'm imagining, is due to reimbursement issues and all of the larger issues that go way beyond education preparedness in getting any sort of healthcare professional to a rural area. And that list is quite a tangent. But I would say that for current medical students, I haven't seen gaps in knowledge in primary care. I've seen a dismissive attitude among certain specialists, and I've seen mostly a lack of access to specialists. I've also seen a lack of access, which I'm imagining is a whole separate question not related to education preparedness. And I am fortunate that I chose a primary care physician who works outside of the hospital system and who is independent and trained at some pretty impressive medical universities before moving to a rural area. And so I think that I am privileged in that way, that she really stays up to date on the literature. She researches stuff. And I feel like she was really well prepared, but she also went through a military fellowship, and she's just got an extensive background. And so I really am curious as to what my experience would be if I was going to your average primary care doc in Chaffee County. I have a feeling it would be different. That's why I chose the physician I chose when I moved here. But I actually can't speak to that particular component because I think I have a really unique circumstance in that way.
Mm-hmm. How have you, how have you maintained and demonstrated compassion during this time? And I know that's a difficult question since you are the one that, since you are one experiencing the coronavirus. That may sound like a crazy question, but I know who you are, and so I'm going to ask you that one. How have you maintained and demonstrated compassion?
it depends on the day, how well I succeed. So I have struggled with patience on our lack of testing. So I essentially ran a fever of around 99.5 for about 4 weeks. It was remittent. So that means it would drop at some point during the day, but come back at night, or drop in the night and come back in the day. There would be about 8 days straight where it would run it straight, like it would never go to normal. And then there would be other days where it would drop for about 2 days and then go back up. But because I never had a fever above 100.4, I have never qualified for COVID testing ever. I'm on week 6. So it has been difficult to I've had a lot of friends, mostly acquaintances. My friends don't really push this, but acquaintances tell me you should lie about your fever so you could get a test. Or you should lie about essentially the only thing stopping me was fever. I was having low oxygen. I was having shortness of breath. I was having coughing spells. I was having all the other COVID symptoms, the aches, the pains, the chills, all of it. But the fever was the one criteria I couldn't ever meet to get tested. And so, that has really negatively impacted my life throughout this whole thing, because I have to assume I have COVID, therefore I can't have my boyfriend or any other person come care for me, but I'm too sick to really cook for myself. But, I live in a rural county and I was on the front end of the wave, and so they weren't doing takeout orders initially. Initially, most of our restaurants shut down, or they didn't have a delivery option. And so I really had to make my own food if I was going to eat, but I felt horrible and I had no energy, and it just was miserable. So if, say, I don't have COVID in this whole process, I could have had help. I could have had someone help take care of me. And I think that if that were possible, I may have been able to prevent the pneumonia from coming on, and the severity and the chronic nature of this. And so it was really tempting to go lie about my symptoms so I could get tested, or to put someone else at risk and ask them to drive me to the Front Range where I would qualify for testing. And so I've had to really make choices about compassion and about putting yourself versus healthcare workers first, or myself versus elderly people. And at the end of the day, remembering, I'm not going into the hospital. I am still eating. I am miserable, but I'm not literally dying. And there are people who are literally dying. And public health is having to make really tough decisions about who can and can't get tested, as is my doctor, as is everyone. And so the right thing to do is to follow the criteria set out and not be tested, even though it means that I feel like I kind of suffer the negative consequences on that. And trying to remember that everyone's doing the best that they can in a pandemic, and no one was prepared for this. And so I also had a really frustrating ER visit where I was, misdiagnosed, and, I walk in with pneumonia and my oxygen's low and my heart rate's high and my blood pressure's 90/70. And I still had to ask the physician to go get a stethoscope and listen to my lungs, because he was just going to let me walk out without doing that, even though I was feeling lightheaded and having trouble breathing. And between that and the misdiagnosis, it's been a struggle to have compassion in that scenario when you have someone who's 5 weeks into being really ill and not feeling like I got the proper care. yeah, there's been a lot of moments of trying to pick, of just being so angry that I can't get the help that I need because I can't get the diagnosis, but I can't get the diagnosis because I can't get the test, and there's a shortage. And it's been a journey of practicing compassion and forgiveness and remembering that everyone is doing the best that they can.
So what have you learned about yourself during this time?
It's really strengthened my faith. So I happen to be Christian, and it's really strengthened my faith during this time, because there's one night where there's several nights where every time I would start to fall asleep, I would wake up gasping for air and check my oxygen, and it would fall, and then my heart rate would like jump from like over 120 and hang out. And so I was having like tachycardia, and it's really scary to wake up and realize that you're not breathing and that you don't know why, and you don't know how to prevent it from happening again, and then it happens again. And I had a coworker actually remind me that God is the breath of life, and that really pulled me through that night. And I have learned, so I guess I've strengthened my faith, or more reminded me of my faith. And I've experienced previous traumas, so I would say that really strengthened my faith. And this has just sort of been a reminder back to that time of like when things aren't in your control, and what can you do when humans really don't have the answers, and they don't have the medical research, and the doctors don't know. And that's the first time I've encountered that. I'm pretty sciencey and nerdy and into medical knowledge, and so it's been a really nice reminder that that's not always the ultimate answer. And it's also reminded me of how amazing other humans are in this time. So I've been really surprised by the support I've received, the love I've received, the just outpouring of family and friends and acquaintances and people I don't even know giving me gift cards or trying to send me, I can't get my own cleaning supplies, but just this past week I was starting to feel ready to start cleaning, and I had people sending me cleaning supplies. So that's been a really special gift.
Yeah. So what has surprised you the most?
People's compassion towards me. When I get on the media, which I try not to look at media that's not relevant to the stage of the disease that I'm in at the time. So I try not to look too far ahead, and I try not to read too much about the past. So I try to read about like what's relevant to me in this stage of my illness currently. But even trying to filter out all of the other media, you still just come across stories, of people being rude or offensive or racist or blaming and angry and protesting. And, most of these people don't even have COVID. And there's been this really almost like mass hysteria of contracting COVID, which is interesting to watch when you're the one who has the disease everyone is so afraid of getting. And I have compared it multiple times to like leprosy in the Bible. It feels like no healthcare professional will see me in person because I have COVID. And so I can't get healthcare because I have to stay home because I have COVID, but I need healthcare, but we're saving our resources for the people who have COVID. And then I'm like, but I have COVID.
Yeah.
And so it's just been so frustrating. I have the thing that everyone is afraid of, and I realize I'm really blessed that I'm not more severe of a case and I didn't need hospitalization, but we're saving all these resources for the people who have the thing that I have, yet I can't access the resources. And there's another area you have to practice so much compassion. But yes, I would say the thing I've been surprised by is the number of people who see that struggle that I'm having and just pour out love and cards. And I had a friend send me menthol releasing bath fizzies last night, so that when you run a hot shower over a tablet, essentially it releases menthol, so it helps you breathe. I mean, people are just coming up with like creative stuff I wouldn't even know to ask for. And I love it. And so that's just been such a gift. And I've reconnected with a lot of people from my past during this.
Awesome. So I would like to know, just in general, how has this impacted your family life? You know, you mentioned your boyfriend, and I know you have family back east, but still, how has this affected your family life?
Well, my mom is immune compromised, so she has 3 autoimmune diseases, and she's 72. So it's really not been on the table for them to come help me because she is a much higher risk than I am. So with my parents, who are my immediate family, I don't have siblings. I think it's just been really frustrating for them. Like, they feel really helpless. They want to help and they don't know what to do. And they see me struggling to find physicians that can give me care or testing. And a lot of those things are just so readily available in North Carolina, where I'm from. I'm from like a Chapel Hill, Durham, like a major medical center in the country. And so this has been very eye-opening for me and my family about how we just took stuff for granted, like ophthalmology. You can't throw a rock without hitting an ophthalmologist where I'm from. And now I'm in Chaffee County and I need an ophthalmologist, and we don't have a single one that's full-time that lives here. So it's been eye-opening for all of my family in that way. As far as extended family, they've really reached out and been supportive, and I've talked to them more since they got sick than I have in a while. And then for my boyfriend, it's been tough. The first 2 weeks, he was pretty terrified of me because he doesn't have any medical knowledge, and he was just hearing like, you know, COVID can cause permanent organ damage and kill you, and stay away from anyone who has it. And so he would FaceTime me every night, but he was pretty afraid to be near me in any way. We don't live together, so I quarantined solo. And then I've sort of watched him, I feel like I've watched him progress through learning about the disease, and now he's my biggest supporter. He brings me soup, he drives me to the doctor, he helps me clean my house, he helps me walk my dog, he's my biggest supporter. And so I think it's really brought us closer. We almost broke up at the very beginning because I felt like he wasn't present, and then it seems like he's really, I would love to hear his answer to this question actually, but it seems from my end that he's really like come a long way and feeling empowered that he can help me now that I'm no longer contagious. That was like a really big shift for him because he doesn't have health insurance and he doesn't have any money. So he really can't get COVID because he can't access care because he can't pay for it. So we've had to protect him sort of again at my expense. But now that I'm not contagious, we've definitely gotten closer and it's been really great. So it's really shown every side of every human that you're close to.
Yeah, I bet. Wow, thank you for that. So Jessica, coping strategies. Is it possible for you to turn this off, or in what ways do you cope for you to just decompress?
One of my coworkers sent me a 21-day meditation challenge, It's about 20 minutes of meditation that I do every day with her. One of my other coworkers started a Bible plan, like it's a group vicarious Bible plan that we do together. That's been awesome, and very timely on what it's talking about. There's actually one that's addressed, it's called Coronavirus in Christ. And so it's like a really interesting look at like how a faith-based perspective can help inform medical decisions and help inform like just daily coping. If you are, whether you're struggling with COVID directly or struggling with just dealing with like the mental health components of a pandemic and living during that. So that's been really helpful. My dog has been the one entity that has not been afraid of me and has been by my side every single day and really patient. And when I'm sleeping 20 hours, doesn't wake me up. I'm not sure how. I didn't know she could go that long without potty breaks. And so she's really been great and helpful for coping. And I would just say the outpouring of everyone else in my life. You know, I think every day I get a package, or almost every day I get a package at my door, and I don't always know who it's from. And it's always a surprise, and it's great. I made a Facebook post of different ways you can help people who have COVID that I'd be happy to share with anyone who's interested. I just put together, you know, I've had coloring books sent to me. That's been really great. I've had, everyone send me your favorite beverage because I'm so tired of drinking water in the same tea because I gave up alcohol and caffeine for this. And so I've also tried to go outside every day that's warm and get sunshine. And even if I don't have the energy to do anything other than sit, it's really a nice time, especially with the grass starting to come out, watching the spring and watching the birds coming out. And, you know, this is one of the advantages to living rural. I don't see the world shutting down around me. I see the same geese fly into the pasture by me every day, and the same deer come by every day. And so that's like really stabilizing, you know, it's like, the world might be falling apart on the news, but like the geese are still here. So that's been nice. So yeah, trying to really take this time to work on myself and just some of the mental health components. I think it's we all have something we can be working on internally, and we usually don't have the time to do it with work. And so I've really tried, my personal issue is boundaries. So I've really been trying to read about boundary issues and how to set better boundaries. And it's been nice to have that during a time when I really need to learn to be more assertive and search out medical care and decide that I disagree with an ER doctor and I need a second opinion, even if that offends them. And so that's been a very timely sort of personal growth thing for me. So I think my best coping strategy is trying to find the ways that this is going to prepare me for the future, to be stronger in areas I was previously weak in. And that kind of gives me some purpose to the whole disease process and patience with it, and trying to see how it will be used for good in the future and not just be a completely negative experience. So that's been my primary coping strategy. Lots of prayer.
Beautiful, just beautiful. Thank you for sharing all that. What would you want how would you want us to record this event for history?
Well, truthfully, first of all, and not painted over with political agendas. With all of the downfalls that we've had as a country in dealing with this. But I hope that by the end of it, we will be able to talk about the positive changes we've made as a society in slowing down and prioritizing what's really important and not getting caught up in the busyness of work and all of these things that really don't matter as much when you're sick and you can't breathe in the middle of the night and you don't know what to do and you're alone. Like, I hope that we all can really take the time to prioritize what we value the most and figure out what that is, because sometimes it's easy to get so busy that you don't need to deal with that, or it's like not the top of the list. So I hope really that it's a shift in our country and our cultural values and the way we treat each other and the way that we treat ourselves, and prioritizing self-care and prioritizing family and whatever it is that someone truly values, whether maybe that's not family, but hey, whatever it is, that we allow each other more space to do that as well. So I hope that that is recorded in history, but I don't want that to be recorded if it isn't true. It's true from my experience, but I hope it's true for others as well.
Sure. And so how would you how would you want this event to be remembered?
As a time of great social change in our country. Like as a major shift in our political and cultural values.
Well said. Yes, short and simple. Well, Jessica, that's all I have for questions, but I just wanted to give you an opportunity to share anything that you feel is really important from your experience, or anything else that you wanted to share for the listeners.
I think the importance of hope. I had my boyfriend and I tried to take a walk one day right before I got pneumonia, but was well enough. I thought I was well enough to walk. It turns out I wasn't. I got pneumonia. But anyway, we took a walk and there was this tunnel that he got a picture of. It was a railroad track going through a tunnel in the mountains, and then you could see the sunshine on the other side. And there was one day I was really struggling. Well, there were like many days I was really struggling with, like, I don't know if I'm getting better. I don't think I'm getting the right medical care. I don't know what to do, but I don't think there is better medical care because we don't have a treatment, but I don't know what to do. But maybe if I was in a local, in a place with all these specialists and researchers, which is what I'm used to having from where I grew up, like maybe it would be better. Maybe I wouldn't be so sick, and maybe I wouldn't be worrying about being blind and all the things. And he sent me a picture of that tunnel with the light at the end of it, because he sent it the next day because I said, I just woke up today and I finally have hope. And he said, you mean it looks like this? And he sent me that picture, which I guess I should now send you since I'm talking about it. And I said, yes, like I don't feel like I'm there yet, but I can see that that there is hope. And so my current concern is that I might have an autoimmune disease because my mom has autoimmune diseases, and I've had a particularly bad bout of COVID to be my age and my health status. And so this might be, and then the uveitis usually signals an autoimmune response. And so I'm about to get referred, as soon as I'm off steroids for the uveitis, I'm going to be referred for autoimmune testing. And that's sort of this big, almost like death sentence in my head, just from watching my mom really, really struggle with her. She's 3, not just 1, but she's really struggled. It's completely changed her life. And I've always dreaded the day where I hear that I have one. And so I kind of lost hope for a little while last week when I was first told that I needed autoimmune testing. And I realized that during that time I lost hope, and it kind of came back over the weekend. I could my autoimmune disease doesn't have to look like my mom's. My COVID doesn't have to look like the people on ventilators. My whole response to this, like I have some level of control as to how I approach this disease and how I might approach autoimmune if that's what I end up being diagnosed with, and how I approach having a chronic illness. But I think the key to all of that is maintaining a sense of hope. And it has to be a realistic hope, you know, it can't be a pie in the sky sort of hope, but trying to set your expectations on where you can see the light and just like keep walking towards that one point, like through that tunnel. And you don't know what's on the other side, but just to keep going through and keep walking towards that light. And so I would just want to say to anyone who's struggling with this, that if there's one thing that you can prioritize to keep yourself sane and healthy, it's to find where your hope is and keep walking towards it.
Thank you so much, Jessica.